Hello everyone, welcome back to my channel. This is Dr. Spinach. So today we are going to be discussing about the kinds of stations that are asked in PLAB 2 examination. So let's get started. So let's start with the history taking ones. So remember, in total, there are nine types of stations that are asked in PLAB 2. So these nine stations are, I'm just scrolling these down here: history taking, psychiatry, counseling, ethics, colleagues, teaching, tele video consultation, examination mannequins and procedures, and finally, Simon examinations. Now, let's start from the beginning. What happens in history taking? So, I'm going to give you a very, very brief review about all of these types of stations. So, how do they present and what you need to do? Okay. So, talking about history taking examination. Now, history taking examination is basic examinations where a patient is going to come to you with presenting complaints. Now you take the history of presenting complaints, followed by the past medical history, followed by lifestyle history, social history, and as well as psychological history. How are they at the moment? So all of these are included in history taking examinations, and after that you come up with examinations and with investigations that will lead you to the diagnosis of the patient, and then you manage the patient. So this is the basics of history taking examinations, sorry, history taking stations. Okay, now moving forward with psychiatry stations. Now, by psychiatry, you understand a lots of stations like depression stations, bulimia nervosa, anorexia nervosa, psychosis. So there are lots of things that are coming on under psychiatry. Now, when we talk about psychiatry stations, why have they been kept from different from history stations, while some of the psychiatry stations follow history taking? For example, depression, bulimia, anorexia nervosa, these are the stations which are very much like history taking stations, which where you follow history taking and then come to do examination, investigations, come to a diagnosis and manage the patient. But some stations like psychotic patient stations, schizophrenic patient stations, or even alcohol or any drug addiction station patients. So these follow their own structure. For example, there is, and we follow some mnemonic in that, like MC, shitfam. And then for addiction stations, we have KHDWT. So you need to understand. I'm not going to go into the details of these, but what you need to understand is that psychiatry stations are kept apart from history taking stations because it has some elements that history taking stations doesn't cover, because psychiatry, and then that is the reason why psychiatry becomes a special, separately kept station. So yeah, we'll discuss when we come to psychiatry stations later on, perhaps in another video. Now, going forward with counseling stations. Now, in counseling, you have different types of stations. Basically, you have to counsel the patient for certain things. Now, these may include test result stations where you have a test result and you have to disclose this to the patient. So, how you disclose it to the patient, that is a trick. How, so you have a test result, you need to know why this patient has this test result. For example, it is that the patient has increase in levels of um, liver enzymes. Now, you can think of a lot of things that can increase the levels of liver enzymes. One of the possibilities, hepatitis. So, you're going to ask questions related to hepatitis in your history taking inside the counseling. So, and then you're going to address them and counsel the patient to avoid these types of things, right? So, other ones are, for example, discharge stations where you are discharging a patient and counseling them not to do certain things. And then There are also review stations. Now, review stations are like a person is coming back to you for their routine checkup, for their routine review. This could be pap smear, this could be diabetes and everything. So, you have to counsel the patient if you find any complications, or even if you don't find any complications, but they're not adhering to medicines, or their routine, their exercise routine, they're not physically active, for example. So basically, counseling stations are the ones where you have to counsel the patient to do something which they might not be following up, okay, or they might not be knowing. Now, moving on to ethics stations. These are the stations where you can be in dilemma as a doctor. So now, for example, a medical error is an ethics station. Medical error on your part needs to be disclosed to the patient. So, how are you going to disclose it is an ethical station. Now, another one would be a breaking bad news station, is an ethical station. How are you going to approach and tell this, that your husband has an intracranial hemorrhage that cannot be treated because his condition is very bad and cannot we cannot do surgery on that. So these are some types of stations that come under ethics station. Now, the very, very important thing that you need to understand in these is, most commonly asked stations in lab examination are ethics and counseling stations. So whenever we are approaching PLAB 2 examination, we need to understand that these two types of stations are very, very important, and we need to understand how to approach these stations and know what to do in these stations. Okay, now let's move on to colleagues station. Now, colleague stations is basically a station where you are approaching your colleague either in the same level as you, or at a lower, or even at a higher level as you. Now, in colleague station, the the most important thing is, how do you approach this station. Basically, you don't go and say that, hello, I'm Dr. Palak, or Dr. Spinach, and I work here at the GP clinic, and how may I help you? So basically, that is an approach for history taking stations. You don't go and approach there as that. You have to be, you know that this is your colleague, so you're gonna approach in a different way. That, hi, Mr. XYZ, how are you doing today? And then build a rapport with your colleague, and then approach the station. Basically, in colleague stations, these are the stations where you are approaching your colleague for coming late to the ward, or you're approaching them because they have not done certain kind of work, or they are coming to the ward by drink after drinking, or under the influence of some drugs. So these are some types of stations, and then you have to approach these stations, how you're going to talk to colleagues, similar to the way as you're going to talk to them at in real life scenarios in NHS. Now, moving on to the teaching stations. Now, teaching stations are the ones that are coming most commonly. So one teaching station usually comes in the exam every day, and you have kind of perhaps around 20 at the max teaching stations. Even that 20 is more, like around 15 stations. And if you do these perfectly, then I mean, you are in for one station, so you just passed one station. Okay, so teaching stations are pretty simple. You should know how to teach. Okay, now moving on to teleconsultations and video consultations. Now, again, the approach to these stations are different. Not like history taking, where a patient is coming to you, and then you have a formal introduction and then ask them their symptoms. Now, teleconsultation or video consultation will also require you to ask them whether they can hear you properly, whether they can see you properly, and then, of course, follow a protocol where you're going to ask their address and ask them whether this is the right line to connect to you in case of emergency, or if you want to discuss the results. So after that, everything goes the same, and then you have to remember that whether or not to call them into the clinic or the emergency department or anywhere. So you should know the symptoms and signs, are they urgent and they need to be referred to A&E? Are they not that urgent and they should be coming to the clinic to get their tests done? Or even then, it's not that urgent, it's okay to manage at home. So these are the things that need to be taken care of in tele and video consultation. Now, I'm going to give you one more thing here, and that is there are two places where PLAB2 examination takes place. One is Hardman Square and one is Hardman Street. Now, what I've seen and heard is in Square, you have less of tele or video consultations, and in street you have more of tele or video consultations. So yeah, so you need to be prepared for both of them, but need to be prepared more if you will have an exam in the street. Okay, next is examination mannequins and procedures, where you will be having mannequins to perform your examination and procedures on. So you need to practice these will include, for example, IV cannulation, and let's say venipuncture, and these can include, for example, in antenatal checkup. So, you know, looking at the, and then this can also be per rectal examination. Now, Simmon, finally, is the last one, where you have a talking mannequin, let's say a talking complete mannequin, not just mannequin, like the complete patient mannequin. It has it has, it has complete human parts. So that is talking complete mannequin. It's usually an ABCDE emergency station, where you should know how to assess a patient who has come in emergency situations with shortness of breath and can't breathe, with loss of a lot of blood, for example, or with sepsis, for example. So you should know how to treat these patients. Now, so that's up for all the 9 stations that usually come under PLAB2. So yeah, it's been a long video now. So I'm going to end this video, and then we're going to start with perhaps all these stations later on. So if you like my video, please click that like button. Do subscribe to my channel for upcoming videos like these, and do not forget to share this with your friends. If you have any questions at all, do comment, and I'm there to answer your queries. Okay, take care. Bye bye. This is Dr. Spinach.